The professional question issues on the exam will be classified in one of the following ways. You may get what's called a simple cognitive question. Now, what's a cognitive question? That's just pure recall. Either you know it or you don't, so it's just a cognitive recall. Which of the following documents may be legally signed by a patient surrogate in the case that the patient is unable to sign the document? Either you know this one or you don't. There's no analysis, there's no evaluation. It's a pure cognitive question. Either you know it or you don't. Do you know it? If you need a minute to read the answers, pause this for a moment. I'll give you the answer now. The answer is D, out of hospital do not resuscitate or portable DNR documents. And you either know that or you don't, so it's purely cognitive. Now, there's also application-based questions in the professional issues section. Application-based questions are a little bit step up from cognitive. So cognitive is pure recall. Application is where you actually apply the knowledge. So it's not just being able to recall it, but it's being able to read the question, interpret it, and then apply it. So let's look at the question on the screen. An elderly patient with terminal cancer is transported via ambulance with dehydration and weakness. The patient called an ambulance for transport. An IV line is initiated and fluid resuscitation is initiated. The patient does not resist treatment. Shortly after the patient arrives, the patient's son also arrives and presents papers proving that he is the durable power of attorney for healthcare for the patient. He insists that the patient does not want IV fluids or other life-saving treatments because of the terminal nature of the condition and requests that IV therapy be discontinued. What is the most appropriate course of action at this point? Now think about that. That one's not pure recall. You don't just pick out the answer. You actually have to apply it. You have to read the scenario given and then interpret it and then apply it, okay? So the correct answer is A, IV fluid therapy should be continued based on the response of the patient during initiation of the therapy, okay? And of course, the rationale for that is because even though the patient has a durable power of attorney for healthcare, the patient seems to be of sound mind, they can make their own decisions. Therefore, that durable power of attorney of healthcare does not apply in this point. But I didn't just recall that, I actually had to read the scenario and I had to be able to apply it. The third and final type of professional issue question you'll get, again, is the hard one, the analysis. So this one requires you to not only read the question, but analyze the information, and then your analysis will require you then to apply it to the answer. So let's look at an example. The emergency nurse administers 0.5 mLs of medication IM in the deltoid muscle of a 24-month-old. The nurse restrains the elbow of the child with a long board to reduce movement during administration of the drug and gently rubs the area to increase absorption of the drug after administration. Which of the following statements about this scenario is most accurate? So as you can see here, this isn't pure recall. This one requires you to read a case study and then to pick out which of the statements about the scenario is most correct. So you actually have to analyze the information to figure out the right answer. Again, these are the hardest questions of all. Now, do you know the correct answer? The correct answer is A. The nurse should not have used the deltoid muscle for this medication because children under the age of 3 years, the deltoid should not be used because of a risk to the radial nerve. I hope you found this information helpful, and I have a whole bunch of other modules available on ways to prepare for a certification exam. Make sure to watch them all, and good luck on your studying.